Hi everyone, it's Derek here from Adumit. So a really good way to approach the management of hematuria is to split this into the management of visible and also the management of non-visible hematuria, and then take things along from there. So we'll cover all of this and more in today's video. So with that said, let's dive straight in. There is a ridiculously long list of causes of both visible and non-visible hematuria. So remember, our approach here is not simply to blindly recall the causes, but rather to think about managing commonly examined aspects of these causes. So let's take a look at the management of visible hematuria in adults. I always feel that the most simple thing to do is just to assess for UTI, because this is common. The good thing is if there are symptoms we can treat, send off a culture, and then follow up after 1 to 2 weeks just to make sure the hematuria is cleared following treatment. So things can get a little bit tricky if there are no signs or symptoms of a UTI, or if the patient is still symptomatic when you review them. In these cases, the next step depends on the patient's age. NICE guidance suggests that if these patients are 45 years or older, they should be referred for further investigations under a 2-week wait referral. If the patient was to be a male, then don't forget to arrange a PSA as well as a PR examination. NICE guidance also suggests arranging a transvaginal ultrasound scan in women over 55 to assess their endometrium if they have visible hematuria, in addition to any of the following: thrombocytosis, anemia, high blood glucose, and an unexplained vaginal discharge. Let's now take a look into the management of significant or persistent non-visible hematuria. In these patients, we'll want to do a blood pressure, check their renal function, and a urinary albumin-creatinine ratio. Now, if the patient is 60 years old or older with non-visible hematuria and either has dysuria or a high white cell count, this particular scenario warrants a referral on the 2-week wait guidance. If patients have unexplained non-visible hematuria and are symptomatic, these patients would need to be referred to urology for further investigation. So let's have a think about our asymptomatic patients with non-visible hematuria. Those patients that are more than 40 years old will need to be referred to urology. Those patients that are under 40 but with an ACR of more than 30, an eGFR of less than 60, or a raised blood pressure will need to refer to the renal team. Thank you so much for watching today's video. If you found it helpful, don't forget to leave a like and subscribe. I know I always say this, but the AKT exam is all about applying your knowledge in a practical way. So don't forget to check out our case study videos that will help you to build up this skill. Until the next time, see you soon.